Well, hello. So, I wanted to come on here tonight and talk about a couple of things. Do you know what this is? Well, do you know what is in it? Now, I already know many of us know about the douche. Many of us have used and still use douches regularly. I'm going to admit, when I was younger and I didn't know nothing about nothing, I used to douche. It was like you had to. After your cycle, you needed to douche. You needed to clear everything out. It was just something that you had to do. It was just like religion. You just had to do that. But do we really know what's in it? Do we really know what kind of chemicals that we're putting into our bodies? Do we really know if this is contributing to us having issues down there? So I wanted to break down what is in a douche. And I also have here some pH balanced feminine wash, because you know, y'all, this one will get us, because it makes a claim that it's going to balance out our pH. But is it really? So tonight we are going to discuss what are in these products that we love so much. Okay, here I have a medicated douche that I got from Walmart. Let's go through a couple of these ingredients. The first and main ingredient for the medicated douche is something called povidone. It's iodine. It's medical terminology is like betadine. So what do we use this for? It's a surgical skin prep. So let's say somebody is going to have a surgery, a C-section, a breast biopsy. They use this to prep the skin because it will get rid of a wide range of bacteria. Now let's put our chemistry thinking caps on, because why do I necessarily want to have that in my vagina? I don't know. But that's one of the main ingredients for the medicated douche. Now, aside from that, there's something called citric acid, and that is found in this product as well. So when you think of citric acid, it's more like the acid part from lemons and limes. That's what citric acid is. It's used as a preservative. It also kills bacteria and infections. But did y'all know that 99% of citric acid is made from black mold? I saw that and I said, now that's just disgusting. So the citric acid is not naturally occurring citric acid like what you find in lemons or limes. It's made from black mold. That's black mold, y'all, like black mold. I just felt some type of way about that. But that's also what is found in our medicated douche. Another ingredient is something called ethylate disodium. These words are a trip, y'all. They're a trip. So that's actually used to treat lead poisoning, but it also works as something that will improve the product stability. So a lot of times, most of the chemicals that we'll see in our products, it makes it a certain texture, or it stabilizes the ingredients, because, you know, these things sit on the shelves for a very long time. So thinking about the things that we're putting in our bodies, these extra preservative type situations can definitely throw off our pH. So the other things that are in here, phosphoric acid, which does work as a pH adjuster. So I'm like, okay, well, maybe I can kind of see why somebody, you know, I can kind of see like where it could have like a little bit of an effect, you know. But it does acidify the vagina. So, but I don't know how much acid do we really need down there. Sodium benzoate, that's another ingredient that's found inside of the medicated douche. It acts as a preservative. Also something called sodium lauryl sulfate. It acts as a cleaning agent. So you might find this in things like laundry detergent or dish detergent. So maybe, I guess, a cleaning agent for the vagina in a douche, perhaps. Sodium hydroxide, that also is something that's found in soaps. It can be irritating though, so if you're using products like this and you find that you get irritation afterwards, then that would make a lot of sense, because of the different ingredients that are in here. These different chemicals, they can always irritate because they're not something that's a naturally found thing or chemical in the vagina. So the environment of the vagina is very sensitive, and anything can just throw it off. Also, sodium phosphate tribasic. This is a water softener. It's also found in things like detergents, also toothpaste, and of course, paint remover. I definitely want that in my vagina. Huh? Not so much. So once we know what it is, like, first of all, I can see why we start having issues with these products, because for one, the vagina has a very specific balance of different bacteria, of yeast, to try to keep things all stable, keep things good to go, keep that pH right. But once we start to introduce chemicals, it can always throw that pH off. So a lot of times I'll have patients that come in the office and they have recurrent bacterial vaginosis or recurrent yeast infections just over and over and over again. And we'll go through a list of what products do they use. That's the first place that typically I'll start, because different things, that we think are not affecting us, in reality they are. So now let's move on to our friend, the pH Balance Wash, which typically always claims to balance us out. Ladies, we don't need no help with our balance. We come out balanced. But once we start using stuff like this, it messes up our balance. So, okay, one of the main ingredients here is called lauryl glucoside. Lauryl glucoside, it allows things to become clean, pretty much. I mean, and I totally get it. Like, I get why that would make sense, why that would sound like that's beneficial to what I want to have in my vagina. Like, that makes sense. It's found in things like soaps, bubble baths, things that make soap suds, like, I guess. There's also an ingredient in here called cocamidopropyl betaine. I had to write all this stuff down because I turned the bottle this way because I just felt bad. I didn't want to put the product all out in the streets that I'm, just kind of talking about piece by piece. So, it's this way. So I had to write down ingredients on a little card. But this cocamidopropyl betaine, it helps bind with dirt, oil, and debris. So that way, these things can be rinsed away easily. Now, ladies, first of all, I'm like, in debris, in dirt, the vagina doesn't get dirty. It's not like the rest of our bodies where we're touching stuff, we're exposed to stuff, we're getting, covered with different bacteria from the things that we're around. The vagina is well protected. You have the outer lips, which are the fatter lips, which kind of protect everything. And then we have pubic hair, if we still have our pubic hair, and don't shave it or wax it, but you got to watch the other video to talk about that. But anyway, that is there as a protective mechanism to prevent stuff that's not supposed to be up in there from getting up in there. It'll trap the debris. If there's debris or dirt or whatever, it would trap it itself. So guess what? We don't need to use this in order to get that effect. The vagina, it doesn't get dirty like that. So typically what I'll tell patients is just use a white, clean washcloth, separate washcloth from the rest of the body. That's good enough to take care of cleaning the vagina. It doesn't need to be scrubbed. It doesn't need soap. It doesn't need any special products because it really does take care of and balance out itself. And I know that is against all the rules. Like, what? Don't put soap in the vagina? Seriously? Yes, seriously. Because any kind of soap, even if it's so-called sensitive skin soap, read the side of that box. It's going to have words on there you can't even pronounce. And that's always a clue. If I can't pronounce it, or I'm over here on, what's the little pronunciation things that you have on Google, like, how do you say this? Then that's probably something I don't want to have down there. Because the vagina, it has a natural pH balance. It has a natural balance of the different bacteria and yeast to keep things under control. It doesn't need any help. Okay, there's also something called tocopherol acetate, which is a form of vitamin E. And I'm like, okay, perhaps. I can roll with that. I can roll with that. And something called polyquaternium 10, which is a thickener. So once again, just some preservative texture type stuff that's in there. There's something called maltodextrin in here, which is another thickener. You have glycerin, which is a moisturizer. You got fragrance in here. You have perfume in here. Anytime there is color or fragrance, that always is going to mean chemicals. And whenever there's chemicals, there's always the potential to throw off the pH balance. So these types of products are not going to be the ones to help us to maintain and regulate our pH, even though it will claim to do that. What else? Oh, the questions. So I did have a couple of questions that came up on the page. One of them was, is there a cure for BV? The answer to that, yes, there is a cure for BV. Bacterial vaginosis is what BV is. And it's pretty much, bottom line, it's just there's an imbalance in the pH. So a lot of times I'll see patients that use different products or different soaps. They think they're doing the right thing, but in all honesty, it's thrown off the pH balance. Typically, we'll use an antibiotic, but I will be honest, no matter how many antibiotics you get, if we still using the same stuff, it's gonna come back. So what usually I'll go through with patients that have recurrent problems with bacterial vaginosis or yeast is, what kind of products are you using? Even down to what you wash your underwear in. if that has a fragrance or a color to it, because anything that comes in contact with the vagina that has a fragrance or a color, that's chemicals, that can throw off the pH. So there is a cure, but along with antibiotics, there also needs to be some hygiene changes if there's something that's not quite where it needs to be. Also, smoking cigarettes, nicotine, any women that smoke, there's always going to be an increased chance of bacterial vaginosis. So there is a cure, and sometimes the medicine doesn't work, especially if you've used the same antibiotic over and over again. You might need to try something different because your body may now be resistant to that medication. So there's several different medications you can use for bacterial vaginosis to cure it. Sometimes we have to do a special long-term plan in order to get you free from these symptoms, because it's embarrassing, you know. It's especially you, and y'all already know, when you got that feeling like, if I could smell it, other people could smell it too. Bacterial vaginosis a lot of times comes with a foul odor. And it does. It makes us insecure about ourselves. It affects our self-esteem. And sometimes we just get tired of taking medicine over and over again. So definitely talk to your healthcare provider about this. If it is something that you don't feel comfortable with speaking to your healthcare provider about, then you need to find another one. So there definitely is a cure for bacterial vaginosis. Even the most difficult of cases, there definitely is a way to overcome it. Probiotics are also a good idea, but they have to be the ones that are specifically for vaginal health. So there's probiotics for intestinal health. When we're talking about BV and yeast, we're looking for the ones that deal with vaginal health. The other question, why do women of color get bacterial vaginosis more frequently? We don't know that 100% for sure just yet, but the thought process is that women of color have a different makeup of the environment of their vagina. And because of that different makeup that we have, the lactobacilli, which is the name of one of the good bacteria that keep it all together, there's not enough. And that may make the environment not resilient enough to be maintained at a normal pH, and so it gives us more risk for having bacterial vaginosis. That's just like the thought about it. We don't know that 100% for sure, but I will say this. Every woman has a different vaginal bacterial environment. It's called a microbiome. Every woman has one that's different. It varies from woman to woman, and it does vary from race to race. So that research is still being worked out. But definitely, we need to keep everything stable and balanced down there. I don't know if these couple of friends here are going to help us to reach that goal. So until next time. Oh, and y'all know I'm going to come for them Yanni steams too, and them pearls. Yep, that's going to be on one of the upcoming videos too. So just so that way, when you are making a choice about what products you're going to use, and I hope it's none. I hope your answer is no products at all. But at least now you can make an informed choice. So until next time, be well.